We discussed previously that the field has come to a point where 3 drug combinations are considered to be the standard of care for the treatment of newly diagnosed patients with myeloma. The same is true for patients who have relapse disease. All the studies show that 3 drugs are better than 2 drugs. So 3 drugs is really the new standard of care. The question on the table is 3 really enough? Should we think of 4 drugs? There are not very many studies using modern therapies that have addressed this question. The first study to do that was published in early 2018. It's the ALCYONE study that was published in the New England Journal of Medicine. It's a hybrid of daratumumab, Darzalex, the CD38 naked antibody drug, which is one of the newest drugs, in combination with old drugs, really very old drugs, melphalan and prednisone, that go back all the way to the 1950s. And also in combination with bortezomib, which is the first proteasome inhibitor that was developed in myeloma. It was FDA approved in 2003. This study used all those 4 drugs, daratumumab, melphalan, prednisone, and bortezomib, the 4-drug combination, in the experimental arm, and the control arm used the 3 drugs, the melphalan, prednisone with bortezomib, so daratumumab was not given in the control arm. This study was presented at an oral presentation at the American Society Hematology meeting, ASH, in 2017 in Atlanta, before it was subsequently published in the New England Journal of Medicine. So these results, as indicated by the prominent journal and the oral presentation at the meeting, they were considered to be striking. The study showed that you had a benefit in progression-free survival. It should be said that the use of melphalan and prednisone and bortezomib is not really a combination that's used in the United States. Melphalan and prednisone, I think, have almost been banned the past 10 years. And this is because of the development of so many new medications that are available. It's still used in other countries. It's used commonly in Asia, in Europe, and elsewhere. So I think the combination in the study is probably not of major interest for treating physicians in the United States. But it is an interesting study, I think, for a couple of reasons. One is that it shows that the 4-drug combination could be a way to go, and there are many new 4-drug combinations in development with more active, more modern drugs. Also, it shows that the daratumumab drug can be used up front, and that's a new piece of information that I think is very important. And the last thing that I think is important is that although the drugs that daratumumab was partnered with, the older drugs, are not that efficacious, still this study showed that you could obtain MRD rates, minimal residual disease negativity rates, in the range of about 20 to 25% in patients treated with these 4 drugs. So I think these are important and interesting pieces that the study delivered.